I want to touch on one other thing that will have to do with the state of Connecticut in particular. You'll notice that we expect that the experience with your doctor could be better, that you could have more time with your doctor. The reason for that is that, first of all, this reform provides a 10% bonus to doctors through the Medicare system who are in the primary care business. And the idea is that that will allow them to hire more nurses, that will allow them to spend more time with patients, so that you have a little bit less of that rushed experience that we all too often have with our doctors. And also because the state of Connecticut, through this reform, is encouraged to put resources into the system so that there are more doctors available, so that they can hire more people. This is important not just for you, it's important because, and now I'll transition into the broader healthcare reform topic, we are going to see millions of Americans for the first time using primary care. So there is a lot in this bill to try to build up and enrich the primary care experience so that those now 31 million Americans who previously didn't have health insurance will have access to good primary care. You know the story here. Any of you who know doctors know that the economics of being a primary care doctor are not nearly the economics of being a specialist. Specialists make a lot more money. We've tried in this reform through loan repayment programs for nurses, through shuffling around medical slots in favor of primary care to slowly over time build up that, that stock of primary care practitioners out there to serve you better. So I am going to leave some time to talk about the healthcare reform generally, but I'd like to take any questions that you have specifically about Medicare or how the healthcare reform affects our seniors. And if you don't have questions, we're welcome to. We do have questions, so we'll start right here. Yes, sir.
Yeah. Is the Medicare group going to send out a supplement? Because these are starting immediately, so is there going to be a supplement sent to Medicare receivers telling the Medicare receivers exactly what the new changes are? Are we going to get supplements?
You will hear not just from people like from your elected officials, but I'm sorry. The question was, will there be information sent to Medicare recipients about these changes from Medicare? And the answer is yes. Medicare will be in touch. This legislation just passed a week ago, so they're now thinking about the communications effort. I would also urge you, there's very good information from the AARP. I would urge you to take a look at their site because they actually have very good information, much more detailed than I can get into in a relatively limited period of time. So you will hear from Medicare, and you will also, if you go to the AARP site, see an awful lot about how the mechanics of this will work. Yes, sir.
I went to get a prescription the other day, and the pharmacist says my insurance company will no longer provide that brand name, but it will pay for a generic alternative. Now, what is this about the insurance is sticking it to the seniors or whoever and denying them brand name prescription drugs, which the generics sometimes are not the same quality and integrity? And also, is there a website or something? How do you compare what Medicare Part D prices are to what your current insurance company is paying? Is there some kind of a comparative analysis I can access somewhere? If I have a specific drug, what does my insurance pay and what does Medicare pay? Is there some place out there?
The question was, the gentleman had an experience where his private insurance plan would no longer reimburse a brand name drug and in fact required him to use a generic. And part two of the question was, is there a place you can go to compare what you would pay in the Medicare system versus your private insurance? So the first part of your question, insurance companies for some period of time now have adjusted their policies. It's not really a Medicare or a government thing. They have taken decisions from time to time that if the generic drug is exactly the same thing as the brand name drug, that they will require you, because it's significantly cheaper to use generics, It's kind of not related to the healthcare reform, but I know it's confusing from time to time for people. If you think that the generic somehow affects you differently than the brand name drug, you can go to your doctor and have your doctor explain that to the insurance company. Doctors don't love to do that, but they will do that. And the insurance company will at least revisit the decision. But this is, of course, something that the insurance companies do frequently to try to reduce their costs, because brand name drugs are quite a bit more expensive than generics. With respect to how you compare Medicare, of course, when you turn 65, you become eligible for the Medicare system. And you can go to the Medicare site, and it's pretty user-friendly. You can have somebody help you if you don't like using websites and whatnot, that will give you an estimate of what your out-of-pocket costs will be in the Medicare system and what's available. The initial entry into Medicare is a little confusing because you do choose between regular Medicare and Medicare Advantage, and it's a little confusing. But the site is a pretty good site, and I'd urge you to have a look. And if you, the other thing to do, of course, is to talk to people who have made exactly that decision to go or not go into the Medicare system.
What is the name of the site?
I'm going to ask I don't know exactly what the website is. I think if you search Medicare, it'll be the first one to come up. But I'll ask Peter, wherever he is, to get me a URL so that we can give it to you. Yeah. Yes, sir.
What's the initial consensus in Washington? You closer to 5 and 3 the Medicare deductible go up for the monthly insurance, which they also deduct from the Social Security. Will these go up under the new plan, or will you stay like this, or will you be reduced?
The question from the gentleman was, will there be any change to the Medicare payments, the Social Security deduction if you're working, the Social Security payments if you're receiving Social Security? The answer is that any change that you would experience with either Social Security or Medicare, in terms of the money that you either get or pay, would have to happen through legislation in Congress. And none of the health care reform that has passed to date will change those numbers for you. Now, the numbers change. For example, Social Security does climb, the payment climbs with a cost of living adjustment. There are automatic adjustments that are made to reflect inflation. But none of this legislation will change what you pay in to either system. Now, we're getting off of healthcare now. Everybody in this room knows that we have a fiscal challenge associated with Social Security and associated with Medicare. The Congressional Budget Office has estimated that the reform that we've undertaken moves the insolvency date of Medicare, that's the date when the Medicare system runs out of money, about 5 years into the future. That's a good thing, but doesn't solve the whole problem. We have an issue with both Social Security and Medicare that could open that up for discussion, but it's not being discussed right now. So until you hear that Congress is undertaking these things, there won't be a change.
Yes, hi, isn't it